Preble County Medical Center sits in the farmlands of western Ohio. As one of the 5 family physicians practicing in the center in a county where there is no hospital, Dr. Harold Allen Ferguson knows the importance of patient care. 6 years ago, he implemented an electronic health record system as a beta project with Athena Health. It's a change he says all physicians must face now.
You have to at some point accept that it is what it is, and that's the way it's going, and that's the way it's going to be. Even though we went through medical school and pen and paper, it's not that way anymore. You know what the kids, the students now are used to the computers, and they're going to be coming up used to this. It's us guys that have been out there, and I've been in practice 24 years, so I was one of those guys, and it can help you. You have to embrace it. If you fight it, you're gonna just bang your head against the wall.
The process of adopting an electronic health record system was a long one 6 years ago on the cutting edge of the change, but one that was well worth it in the end.
We had a basket that we kept some of the charts in, and we had to file them at the end of the day, and so yeah, we had to look for the charts, and now we just pull up their name and they're there. So.
With patients calling in for refills, we put it in the computer, and then we kind of email it back to Dr. Ferguson. So I mean, he can look at it from being in the room, or he can look at it back in his office. Wherever he has his computer, he can.
If they're coming in for certain problems, I can put it in, check mark each one, and then he'll have it as soon as he looks at it. I save it, and he can just pull it right up.
A computer is a tool, and therefore doesn't make better care happen. It's a doctor who can provide better care.
Care, the possibility is there to give better patient care. Are you necessarily going to give better patient care with EHR? Not necessarily, because trash in means trash out. I mean, if you're not doing a good job with your records, you're not going to have a good record there. It's like a stethoscope. A stethoscope is to help practice better medicine. Well, if you don't really know what you're listening for, it's not going to help you do any better getting a better stethoscope. So getting a better computer is not going to necessarily help you practice better medicine.
6 years after adoption, Dr. Ferguson is successful with his electronic health record system, as he was one of the first physicians to receive an $18,000 Medicare incentive check. He and his office staff offer some advice to other practices looking to implement an electronic health record system.
Well, I thought it was too daunting in the beginning too, and you just have to take it a little bit at a time.
Everybody's looking at the same screen, so it's not like this person had to learn a completely new thing over at that desk versus that desk over there. I mean, we're all looking at the same computer. And
it's much easier once you get onto it. And there's still sometimes, that you'll think, I don't know where to find it in the chart or something, but we all work together.
Dr. Ferguson looks to the day when patient care will be transformed through a health information exchange, improving patient care, eliminating unnecessary tests, lowering costs, and even saving lives.
I guess if everything was real-time interfaced, which is a long way down the road, that could save you money. I mean, I see the savings as a person goes to a hospital and has tests done, and comes to me and I do tests, and then has to go to a specialist and they do tests. And that redundancy, well, until you get everything real-time interfaced, that's not going to really save you that much money.
In fact, a statewide health information exchange called CliniSync is in the making through the Ohio Health Information Partnership. For more information on CliniSync, visit www.clinisync.org.